Hello, in this video we're going to be talking about the muscles of facial expression. Just with regards to the embryological origin, they all develop from the second pharyngeal arch, and hence they are all innervated by the facial nerve and specific branches of the facial nerve. So in this video, we're going to be focusing on the three groups of muscles: the orbital group, the nasal group, and the oral group, then talking about the clinical relevance, and then finally finishing with the references. So starting with the orbital group, these muscles are essentially associated with the eye socket, and they control movements of the eyelids, which stop any damage to the cornea. So starting with the orbicularis oculi, this is the muscle that surrounds the eye socket, and it has three parts: the palpebral part, the lacrimal part, and the orbital part. Origin of the muscle is the medial orbital margin, the medial palpebral ligament, and the lacrimal bone, with the three parts respectively. They insert into the margin of the orbit and the tarsal plates of the eyelid. So essentially, as you can see in the picture, all around the eye. The actions are gently and tightly closing the eyelids and drainage of the tears. More specifically, the palpebral part is associated with gently closing of the eyelids, while the orbital part is the tightly closing of the eyelids, and the lacrimal part is involved in drainage of the tears. This is innervated by the facial nerve, more specifically the temporal and zygomatic branches of the facial nerve. Next, we have corrugator supercilii. This is a lot smaller and it's located posteriorly. It originates from the medial aspect of the superciliary arch and inserts into the skin of the eyebrows. The action is to draw the eyebrows together, creating like wrinkles, and this is associated with frowning. And the innervation is the facial nerve, more specifically the temporal branches. Next, we have the nasal group. So the nasal group are the muscles of the nose, or associated with the movements of the nose and everything surrounding it. We start with nasalis, which is the largest muscle, and it has two parts to it, a transverse and alar part. Both of these parts originate from the maxilla, and the transverse part inserts into an aponeurosis, which is on the dorsum of the nose, while the alar part inserts into the alar cartilage, which is associated with the nasal skeleton. The actions: so the transverse part is there to compress the nasal opening, while the alar part does the opposite and widens the nasal opening. And both of them are innervated by the facial nerve, more specifically the buccal branches. We then have the procerus, which is the most superficial nasal muscle, and it originates from the nasal bone and inserts into the skin on the lower medial forehead. The action is to pull the eyebrows down, again creating that frowning expression, and the innervation is again the facial nerve, again the buccal branches. Finally, we have depressor septi nasi, and it originates from the maxilla and inserts onto the nasal septum. The action is to pull the nasal septum to widen the nasal opening. It assists the alar part of nasalis with this, and the innervation is the facial nerve, more specifically the buccal branches. Then we have the oral group. So these are related to the movements of the mouth and the lips, and they're also associated with the sound production. So they are required in like singing and whistling and in talking and vocal communication. So we start with the orbiculus ori, which is the main muscle of the lips. It originates from the maxilla and the muscles of the cheek, and it inserts onto the skin and mucous membrane of the lips. The action is to close the lips, and the innervation is the buccal branch of the facial nerve. Then we have the buccinator. This is actually deep to all of the other muscles of the face, and it originates from the maxilla and mandible, and then inserts into the orbiculus ori muscle and the skin of the lips. The action is to pull the cheek inside against the teeth, and essentially to prevent any accumulation or buildup of food in that area. And it's innervated by the facial nerve, more specifically the buccal branches. There are some other minor muscles that act on the lips and the mouth, and they can be divided into a lower and upper group. Finally, we are going to be talking about the clinical relevance. So as seen and as discussed with the embryological origin, all of these muscles are innervated by the facial nerve. So if the facial nerve is damaged, it's going to be affecting all three groups: orbital, nasal, and oral group. Starting with the orbital muscles, these are the only muscles that close the eyelids. Damage to the orbital nerve would mean that the cornea could dry out because the eyes can't close, which is actually called exposure keratitis. It can also lead to a failure in clearing debris because the lacrimal fluid is pooling and the lower eyelid is drooping. And essentially, facial nerve damage can lead to Bell's palsy, which is seen in the image here. With regard to the oral muscles, damage to the facial nerve could lead to difficulty in eating because food may accumulate in the teeth and the cheeks, as we saw earlier, the buccinator is involved in this. And as I said, Bell's palsy, so it essentially means the side that's affected is drooping, and even when the person is smiling, their smile is going to be sagging, as we can see in these images. These are my references. Thank you.